This next video will describe the emergency log roll. The first part of the video will talk about the hand positioning. In this particular position, the therapist's right hand will go on top of the head and the left hand on the bottom, just over the ears, with the thumbs pointing towards the face. From a superior view, put one hand on top, again thumbs to the nose, and one hand on the bottom. Now as you can see, your arms will slightly be crossed. The end position, your arms will be straight. Now the question is, how do you get into this position from assessing? So when you approach the athlete, you should approach them so that you can see their face right away. Put one hand on the head to stabilize C-spine and the other one is free to check for ABCs in consciousness. From this position, you can swivel around so that your body is at the head in preparation to roll, with your hands in the proper place with thumbs pointing towards the nose. Now during the roll, your assistant will take the torso with one hand over the shoulder and one hand over the hips. The next part of the video will take a look at the two rescuer roll with the most trained person at the head.
1, 2, 3.
This next section will demonstrate how to roll a person if you're by yourself. There's two different types, pulling the patient and pushing the patient. In every situation, you want to make sure you do have helpers rolling a patient with a suspected spinal injury. However, if by chance you are by yourself and there's no way to have another person help you and they have to be rolled, here are two ways that you can do it. Now this first way is going to show how to pull the patient. Abduct the arm closest to you above the head, reach over and grab the waist and support the base of the skull. And when you've got a good grip, just pull. At the hips, the body will follow and then support the head. This next clip is going to demonstrate the single rescuer log roll by pushing the patient. Just like we said before, try to have a bystander or somebody else help you roll the patient. Only roll the patient if the person is not breathing. If they're breathing, just leave them as they are. If you are by yourself and you must roll them, then this is just another method to do so. Now when you're facing your patient and you're stabilizing C-spine with one hand and you've assessed that you need to roll them, stay on the same side that you're on, abduct the arm that's closest to you, slide your hand closest to the head under that arm, and then cup the back of the neck. Grab the hip closest to you, and when you're ready, lift the hip and use your forearm to lift up the shoulder, and as you roll, support the head until the patient is completely supine. Now from this position, you can continue your assessment. Now here are the key points to log rolling. You have to roll the person when they are prone and you find out that they are not breathing or they do not have a pulse, even if you're by yourself. So remember, if you are by yourself, regardless, you have to roll them. ABCs, or any life-threatening emergencies dealing with airway, breathing, and circulation, supersedes any issues with the spine. When possible, use assistance. Try to instruct a bystander how to do the roll if they need some instruction. And last but not least, the highest trained individual in the team always controls C-spine during the roll. Communication is very, very important when you're working with another rescuer, and to be good at these maneuvers, just make sure you practice. Now for the purposes of this study, you do not have to instruct your assistant how to take position and how to do the roll. All you need to do is tell them to help you with the roll or to grab C-spine, and they will do it. And again, you do not have to give them any kind of instruction.